Welcome, everyone. It's the top of the hour, so we will go ahead and get the session started. Thank you so much for coming to the presentation of ASPR TRACIE, a healthcare emergency preparedness information gateway. My name is April Wright, and I am an outreach and education librarian for Region 1 of the network of the National Library of Medicine, and I will be your host for this session. I'm also joined by my colleagues Erica Lake and Sarah Levin-Lederer and Molly Knapp, who will all be kind of helping out with the chat and everything. So just a few informational items before we get started on our presentation. Everyone has been muted to limit background noise, but we do welcome your questions and comments at any time. You can use the chat function to share your comments and questions. Molly Knapp and Erica Lake are providing production assistance today, and they'll be keeping an eye on your posts. So they will queue up your questions as they come in and save them for our speakers to address at the end of their presentation. As a reminder, by registering for this webinar, all attendees have agreed to abide by the NNLM Code of Conduct to foster a respectful and professional learning environment. Closed caption has been enabled and is available by clicking on the icon at the bottom of your screen with 3 dots and then selecting closed caption. We are recording today's presentation, and we will post it on the NNLM YouTube channel in 1 to 2 weeks. At that time, everyone who registered for this session will receive an email from us with the link for the recording, so keep an eye out for that. This webinar is eligible for Medical Library Association and CHES continuing education credit, which you'll be able to claim through the evaluation link we will share at the end of the session. And and speaking of the evaluation, your feedback really matters. It helps us improve our future training, so please take a moment to complete it. Now, since some of you might be first-time attendees, I'd like to share a few words about who we are at NNLM. Now, the National Library of Medicine, NLM, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like Medline Plus and PubMed. NNLM, the network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. If you'd like to connect with your regional medical library or learn how to become a network member, you can check out our website at nnlm.gov. Today's session is part of the NNLM Virtual Disaster Preparedness Forum, which is taking place September 12th through the 28th. The forum features expert speakers presenting on data tools and resources, disaster planning communication, and institutional preparedness with a focus on greater inclusiveness and community resilience. You can learn more about the forum and register for other sessions by checking out the NNLM training calendar. We'll drop the link for the training calendar into the chat. We're also excited to highlight a collaboration with another NNLM program. In observance of National Preparedness Month, the NNLM Reading Club has selected 3 books and gathered information from trustworthy sources to help you take action and stay safe. More information is available on the NNLM Reading Club website. We'll drop that link in the chat too. Now, it is my great pleasure to introduce our speakers for today's session. All of them are with the U.S. Department of Health and Human Services, Administration for Strategic Preparedness and Response, ASPR, Technical Resources Assistance Center and Information Exchange, TRACIE program. Rachel Lehman is the acting director. Audrey Mzurek is the ICF TRACIE program director. Karina Sole Brito is the ICF Deputy Project Manager. Bridget Kanawati is the Assistant Center Project Lead. And Jennifer Narako is ASPR TRACIE Special Projects Lead. Welcome to you all, and thank you so much for presenting. I will now turn it over to Rachel.
Thank you so much for that kind introduction, April. It is such a privilege for the ASPR TRACIE team to be presenting during the network of the National Library of Medicine's Disaster Preparedness Forum. So thank you so much for having us. The ASPR TRACIE team is excited to give you an overview of the 3 domains of ASPR TRACIE and to discuss recent resources and tools we've developed in coordination with our subject matter expert, Padre. Next slide. ASPR TRACIE, or ASPR's Technical Resources Assistance Center and Information Exchange, is a program in the Administration for Strategic Preparedness and Response. And right now, ASPR has 4 key priorities to meet its mission: prepare for future public health emergencies and disasters, manage the federal response to and recovery from public health emergencies and other disasters, improve and leverage partnerships with healthcare and public health stakeholders, and lastly, ensure workforce readiness through the development of innovative workplace practices. Next slide. My favorite way to describe the ASPR TRACIE team is small but mighty. And April already provided great introductions to most of the team, most of the team is presenting today. But in addition to your presenters, we also have Dr. John Hick, our senior editor, who additionally is an emergency physician and a professor of emergency medicine, and Claire Nyquist, a communications analyst. Next slide. So I'm going to start off today by giving you a brief background on the developments of ASPR TRACIE and who we work with. So ASPR TRACIE was launched in 2015. The development and functionality of ASPR TRACIE was collaborative, involving multiple HHS operating divisions and other federal government departments, local, state, and regional government agencies, national associations, nonprofit organizations, and private sector partners. Outreach was conducted to hundreds of individuals through these organizations to obtain feedback and recommendations. There were 3 specific milestones that led to the development of ASPR TRACIE, which include a 2010 GAO report, which resulted in a focused ASPR effort to create a collaborative workspace for stakeholders, ASPR and CDC's 2013 engagement with cooperative agreement awardees on how to improve ASPR's Hospital Preparedness Program, or HPP, and CDC's Public Health Emergency Preparedness, or PHEP program. Then in 2014, ASPR's Hospital Preparedness Program identified 3 areas of need which align with ASPR TRACIE's 3 domains: an online repository of vetted resources, a centralized method to provide timely technical assistance, and a mechanism that allowed for end users to communicate directly and share promising practices. Next slide. So ASPR TRACIE works with a wide variety of stakeholders, including regional ASPR staff, healthcare coalitions, healthcare entities, healthcare providers, emergency managers, public health practitioners, and others working in disaster medicine, healthcare system preparedness, and public health emergency preparedness. Next slide. ASPR TRACIE is a cross-cutting program, so it's important for us to work with and collaborate with partners across HHS and the federal government. Within ASPR, we work with offices and programs that focus on emergency mitigation, preparedness, response, and recovery. Additionally, we maintain relationships with all of the operating agencies of HHS and with other federal partners, including the Federal Emergency Management Agency, the U.S. Department of Transportation, and the Veterans Health Administration. Next slide. ASPR TRACIE is a healthcare emergency preparedness information gateway. It creates new resources to fill gaps in healthcare system preparedness capabilities and fulfills the technical assistance needs of those working in disaster medicine and healthcare system preparedness. By sharing information in timely and innovative ways, ASPR TRACIE bolsters planning and response efforts across the nation, serving as a virtual force multiplier. In the last 8 years, we've responded to over 11,000 requests for technical assistance, have welcomed over 1.7 million visitors to our website, and I'm also very proud to say we've maintained a 99% customer satisfaction rating through our Systems Center. And now it is my privilege to turn it over to Audrey Mazur, our project director. Over to you, Audrey.
Hey, thanks, Rachel. Good afternoon, everyone. As Rachel already mentioned, ASPR TRACIE has 3 primary domains, which consists of our technical resources domain, which is where our resource library is housed, and our assistance center, which is open Monday through Friday, 9 to 5 Eastern, excluding federal holidays. Folks can call in or email requesting technical assistance through our Assistance Center domain. And our information exchange, which is a peer-to-peer online discussion board with near real-time sharing. And this is the only part of ASPR TRACIE that is password protected. We're going to do a deeper dive into each of our domains shortly, so I don't want to steal anyone's thunder now. As this slide depicts our growth over the years, you can see there's, of course, a sharp increase in technical assistance requests and visitors to our website and membership into the information exchange, particularly in 2020 and 2021. We're starting to see that stabilize again, but this is just a quick snapshot of ASPR TRACIE's growth over the years. And as soon you will hear from our staff on how ASPR TRACIE supports all phases of healthcare preparedness and emergency management. We've developed hundreds of resources in response to incidents such as no-notice mass violence incidents, COVID-19, civil unrest, and resources also in anticipation of incidents such as, for example, cybersecurity attacks on healthcare systems and patient surge considerations. But it is now my pleasure to turn over to our Deputy Program Director, Karina, who will be discussing our technical resources domain.
Thank you, Audrey, and thank you everyone for having us. Next slide, please. So Audrey sort of highlighted how we like to pride ourselves in serving as what we call a virtual force multiplier to our stakeholders and do what we can to get them the information that they need as quickly as possible and in practical portions. So one example of this is our resource pages that you see here on the screen. We know that they don't have a lot of time to click around for resources, so we took some overarching themes like mass violence, healthcare coalitions, and the emergency preparedness rule, and we created pages that include links to all of the products that we've developed specific to that topic. We also create, as Audrey said, resource pages in response to an ongoing threat or incident, such as COVID-19, pediatric surge, which we are starting to review and update, and countries in conflict. So you can click on the link at the bottom of the slide when you get it to access all of our resources and our most recent annual report. Next slide, please. Okay, this is the ugliest slide of the presentation, but we like to call our 60 topic collections the meat and potatoes of our technical resources domain. I like to say that we cover topics from A to Z, or active shooters to Zika. It's crowded, but it illustrates the variety and how we categorize some of our collections. Every topic collection is built and reviewed the same exact way. We cast a very wide net to identify and review the literature, and we use our own parameters that we've developed to narrow down what we will include for review. Resources, for the most part, need to be published within the past 10 years or so, but we do allow some classics in our collections. And they also need to be freely available, though we do also include some articles for which only abstracts are available. Every collection is comprehensively reviewed by members of our subject matter expert cadre, and those marked with asterisks have been reviewed more than once. Every collection has some of the same categories as well. They each have a must-read section, which is comprised of resources that subject matter experts deemed as the best in show. And they all have a lessons learned section where we highlight real life experiences from recent disasters, an education and training section where we provide links to free related training, and a plans, tools, and templates section where we provide links to tools that users can either just implement or tailor to their needs. And I did want to highlight and call attention to our two newest topic collections, the Climate Change and Healthcare System Considerations collection, and the LGBTQI+ Community and Disaster Preparedness and Response collection, which we released on the anniversary of the Pulse shooting. So on the next few slides, I'm going to highlight a few specific categories, and then we'll hear more about the Assistance Center. I'm sure everybody on this call knows that mass violence incidents pose a significant challenge to victims' loved ones, survivors, emergency responders, healthcare facilities, and communities in general. And we also know that workplace violence was a challenge before the pandemic, but anecdotal evidence suggests it only got worse during and since. So here we've got two topic collections, various resources, including speaker session recordings, tip sheets, and a planning considerations tool, and 3 issues of our exchange dedicated to these topics. The exchange is our newsletter that comes out several times a year and is focused on a specific theme for each issue. Articles always represent the federal, state, and local point of view from the field. Next slide, please. We've also developed many resources on natural disasters and have recently focused more on extreme heat events, wildfires, and utility outages. We've shared experiences associated with evacuating healthcare facilities during or just after floods, wildfires, and some during the actual COVID-19 pandemic. One of our newest topic collections, as I said, the climate change resilience one, also includes a new topic area that we added during the summer when so many areas of the country were being affected by wildfire smoke. So we added a category that focuses on air quality issues to that collection. Next, please. And my last slide covers one of my favorite topics, behavioral health and community resilience. So even before the pandemic, we saw disaster responders running towards the situations that most of us ran away from. And one of our first resources that we created and most requested to this day is our tips for retaining and caring for staff after a disaster. We did update that during the pandemic as our stakeholders shared their promising practices with us. And many of those, which range from providing acupressure to relaxation rooms and identifying and addressing stress in yourself and your colleagues, can be found in issue 12 of the exchange, which is included at the bottom of this slide. We also created longer and shorter sets of modules that healthcare staff can use to identify and manage stress, compassion fatigue, and burnout. So while I think that all of the topics that we cover are important, none of them can be accomplished without healthcare providers who are resilient and feel valued. And on that note, I will turn it over to Bridget Kanawati to tell us more about the Assistance Center.
Thank you, Karina. Again, I'm the Assistance Center lead. My name is Bridget Kanawati. The graphic on the left shows the homepage for our Assistance Center. There are 3 main ways to contact us for technical assistance support. Requesters can call us, send us an email, or submit a request online using our online request form. On the Assistance Center page, we also feature a TA response that we newly developed, or sometimes we include a previously developed document that is on a trending topic. For example, you can see here the COVID-19 After Action Report resource is an example technical assistance response document that we developed. So a few months ago, we were receiving several requests for COVID-19 After Action reports. So what we did was we took our previously developed document, we updated it with new resources that we had found online, and then we featured it on this page so that other users can benefit from it. If you look on the right of the slide, we want to highlight the infographic there, which illustrates trends in ASPR TRACIE technical assistance requests from 2016 to 2022. The first bar chart displays our continued increases in requests over the years. I should note that in March 2022, we reached 10,000 TA requests, and this infographic highlights that achievement. And this was used for marketing purposes to our audience. The next graphic there to the right shows our top TA requests by category. So COVID-19 leads the list, followed by CMS, emergency preparedness rule, and natural disasters. The pie chart illustrates who requests technical assistance from us. It's a close tie between private healthcare entities and healthcare coalitions. And for any requests in which we develop a TA response document or one that requires us to reach out to a subject matter expert, we will send those requesters a customer satisfaction survey. And that next graphic there just shows our great customer satisfaction rating, as Rachel and Audrey had mentioned. Next slide, please. So this slide displays our TA landing page, our technical assistance landing page. Whenever we receive a request that requires us to develop a personalized technical assistance response document, we post it to our TA landing page, as you can see here, so that other users can benefit from the information that we provided the original requester. So as previously noted on the last slide, we have received TA requests on multiple topic areas, and a sample of those are shown on the left side of this slide. So that's just in that section's navigation bar right there. That's where it's just a snapshot of some of the topics that we have technical assistance requests on. You can simply click on any of those specific topic areas and be taken directly to that section to review all of the technical assistance response documents that we have developed on that subject. For example, on the right side of the slide, you'll see the first 3 examples of our COVID-19 TA requests, technical assistance requests. And we also provide a brief annotation for each of those technical assistance response documents so users will know what it's about. Next slide, please. So this slide shows a sampling of 3 different technical assistance response documents that we have developed. Each technical assistance response document is personalized and provides a list of resources relevant to the ask. In some cases, we have specific requests that requires feedback from our subject matter experts. For example, the technical assistance request in the middle includes extensive subject matter expert input. Not only did we provide the requester with resources on hospital water storage tanks, which you can't see in this snapshot here, but you can see that we have extensive SME feedback, and you can see some of those comments there. Our SMEs always go above and beyond in supporting us. You can quickly see some of their comments in the middle, as I mentioned. For other technical assistance response documents, we may take a search a step further and pull out relevant pieces of information for the requester. For example, in our palliative care and COVID-19 technical assistance response document all the way to the right, we developed lists of considerations that we thought would be beneficial to the requester. So as we're gathering this information and reading through the resources, we kind of pull out those important nuggets of information, and we put it into a bulleted form to make it easier for our requester to digest. So whenever we can go that extra mile for the requester, we do that. Next slide, please. So we currently have over 1,300 subject matter experts in our SME cadre. Our SME cadre has grown tremendously. Professionals have applied on their own through self-referral. We have a button on our site where folks can sign up and apply, as you can see here on the snapshot. Some of our SMEs and stakeholders have referred other colleagues, and we've grown a lot that way as well. We have also recruited individuals that we have engaged along the way through conferences, and even some of our very own TA requesters that we've gotten to know along the way as well. So we've already discussed some of the ways in which our subject matter experts support us, but again, those include assisting with TA requests, technical assistance requests, peer-to-peer discussions, and being involved in those, assisting with original ASPR TRACIE content development. Audrey mentioned some of the documents that we've developed over the years, assisting with topic collection development that Karina mentioned and the review of those, and helping to enhance our website and outreach materials. Next slide, and I'll pass it back to Audrey Mazur to talk a little bit more about the information exchange. Thank you.
Great. Thanks, Bridget. Thanks so much. So as I previously mentioned, the information exchange is the only part of ASPR TRACIE that requires a username and password. It is an easy, free registration, but it is required just to ensure that members of the IE can freely share resources and ideas with one another without possibly being spammed or solicited by third-party vendors. There's also a feature within the information exchange where we can create a private group for example, coalitions or working groups to have a private space to share resources and discussions amongst their membership group. And when you're logged into your account, which again is a free registration, you will also have access to your user dashboard. The dashboard allows you to do things like edit your profile, track your search history, saves any resources that you've marked as a favorite. It can also show you any resources that you might have left a review for or a rating on. We do have a rating and review feature for all of our resources in our repository. And also it can show you what your membership status is for the information exchange, or if you're part of any private groups of the information exchange. And now I'd like to turn it over to Jennifer Narako, who's going to talk a little bit about some of our special projects. Jennifer?
Thanks, Audrey. Just turning everything on. So in the past, many of our special project activities were supported through supplemental funding associated with outbreak-related public health emergencies. But more recently, we've been branching out to other topics based on evolving needs, requests from ASPR TRACIE users, ASPR TRACIE priorities, and current events. Many of these special projects are complicated. They could be months-long projects with extensive collaboration with other staff and organizations. Next slide, please. So one example of a major special project was the development of the Disaster Available Supplies in Hospitals, or DASH tool, which was released just over a year ago at dashtool.org. This project originated as a specific request from an ASPR-TRACIE users, but over the years, we've received numerous technical assistance requests from healthcare facility staff about how to estimate the types and amounts of supplies they should have on hand for different types of emergencies. Based on that initial request, ASPR-TRACIE began collaborating with Healthcare Ready, the Health Industry Distributors Association, and the Region 7 Disaster Health Response Ecosystem in early 2022 to address the need for a more user-friendly and robust tool to replace ASPR-TRACIE's existing Excel-based pharmacy and PPE tools, which were themselves previous special projects, and to create new tools for burn and trauma supplies. We've been promoting the tool over the last year, and we are also seeking feedback from users about potential improvements and enhancements to DASH in the future. Next slide, please. The COVID response, as you saw from some of the previous slides, involved a lot of effort and time on ASPR-TRACIE's effort. As Bridget mentioned, we responded to over 3,000 COVID-specific TA requests. We began daily tracking and monitoring of COVID information in January 2020, and we continue to monitor developments to this day. We established a COVID-19 resources page early in 2020 to make it easier for ASPR-TRACIE users to find information relevant to the pandemic. That page includes 20 COVID-19 resource collections. Throughout 2020, these collections were updated multiple times per week with the resources identified through our tracking efforts or shared by our users or by ASPR and other interagency partners. These collections are similar to the regular topic collections that Karina discussed, but nearly all of the resources included in these resource collections were developed in response to the pandemic. We're currently reviewing all of these collections and moving some of these resources into our regular topic collections where they're relevant. The page also includes more than 100 new resources that we developed during the pandemic. We are currently in the process of revising select documents to make them applicable beyond COVID-19. And a sampling of our resources is listed here, and there's many more that you can find on the site. We also have recordings from dozens of speaker series presentations and webinars that we've conducted. Next slide, please. Prior to the pandemic, ASPR-TRACIE began exploring the role of settings outside of the 4 core healthcare coalition members, which are hospitals, public health, emergency management, EMS. So we started looking at the roles of urgent care centers, health clinics, home health and hospice agencies, practice-based primary care providers, and accountable care organizations in emergency preparedness and response. We conducted a mix of online surveys and one-on-one telephone interviews with a convenient sample of leaders from each of those healthcare settings, with topics including the role of each setting in infectious disease and no-notice incident scenarios, the level of capability and infrastructure for response, characteristics of their preparedness activities, the status of their business continuity efforts, and factors that facilitate engagement in emergency management activities. We developed a number of resources based on that project that are also available on the ASPR-TRACIE website, and those might be of interest depending on what areas you are working in. Next slide, please. As I mentioned at the beginning, a lot of our special projects have been focused on infectious disease threats. This slide lists some of our ASPR-TRACIE developed infectious disease resources. As Bridget mentioned, our SME cadre is highly involved in the development and review of these resources. And we also engage closely with our partners to ensure we're releasing accurate and useful information along the way. And then next slide, please. And then finally, I'd like to highlight one of our upcoming resources. We are developing a toolkit on utility failures in healthcare. It includes tip sheets to help healthcare facilities prepare for interruptions to communications and information technology, electricity, fuel, oxygen, and water. We sent a draft of the toolkit to a large group of SMEs earlier this week for their review and feedback. So keep an eye out for the final toolkit to be released later this fall. And with that, I'm going to turn it back to Audrey.
Thanks, Jennifer. Thanks so much. So in addition to all the resources that we've presented on already, and I know it's overwhelming, so we hope that folks have a chance to take a look at our site when you get a chance. Definitely click through the slides when you receive these. But we wanted to specifically highlight some of our webinars and our speaker series. The speaker series are short recorded presentations on very specific healthcare preparedness topics. And we've also done dozens of webinars over the years that range in topic from pediatric issues and disasters to cybersecurity considerations for healthcare facilities. During the COVID-19 pandemic, when it was more challenging to schedule live webinars, is when we really started conducting those recorded presentations, and we've continued those to this day. So those are around 15 to 20 minutes, again, focusing on highlighting promising practice to lessons learned during disasters. And then we wanted just to provide a sampling of some of our most recent resources that we've developed that you might be interested in. So for example, we did a speaker series recording with the California Department of Health and healthcare facilities discussing the impact of planned and unplanned power outages. We have a webinar that we did on lessons learned in healthcare communications prior to and during the pandemic. And most recently, as Karina had on her slide as well, as the exchange that's focused on water and other utility outages. So over the last 8 years, we have been extremely honored to serve the healthcare and public health sector, disaster medicine, emergency management folks, and really proud of that 99% customer satisfaction rating. But of course, we know that the field is constantly evolving and changing. So we really appreciate continued engagement with stakeholders and partners such as NLM, and we continue to encourage dialogue and quality improvement. So your feedback is very welcomed and highly encouraged. So with that, I'd like to turn it back over to Rachel to close this out before the Q&A. Rachel?
Great, thank you so much. I think everyone can see why my job is such a joy, is because I get to work with the amazing ASPR TRACIE team every day. First of all, I also wanted to start by saying thank you all for everyone who joined today's webinar, for taking time out of your busy schedules to join us and learn more about ASPR TRACIE and our resources. And we are happy to take questions. I think I only saw one in the chat, which was related to acronyms. I apologize that we use a lot of acronyms without always spelling them out. I think that is a bad habit we have. I know I personally have that, but we're happy to take any other questions that anyone may have. And it's also okay if people do not have questions.
They were all stunned into silence of so much information. I was kind of like, what is this resource?
Rachel, someone actually did ask about any resources on extreme heat events and or smoke events.
Karina, I think you actually are the perfect person to answer that, so I'll give that one to you.
Okay, well, thanks for asking, Barbara. We did just recently release the exchange, and that did include an article on Seattle's experience with a heat dome in 2021. So that's one article I would suggest, and I can put links in the chat. I just can't do it while I talk because I'm terrible at multitasking. And then we also have 2 sections in our natural disasters topic collection. One is on lessons learned from extreme heat incidents, and one is on plans, tools, and templates related to the topic. And then I think you asked for smoke events. We did add the air quality topic to the topic collection, the climate change topic collection, which we will also add a link to in the chat. And there are quite a few resources coming out of the West, that came out of the West Coast, that do talk about the effect of wildfire smoke on health. So I hope that answered your question.
We do have one question. A lot of our attendees don't work in healthcare or related fields, but may work with local public health or healthcare partners from an information specialist library side. Any suggestions for best practices for these folks?
I'm sorry, we'll say we are pretty focused on healthcare preparedness more than public health in other areas. but a lot of the resources we have are applicable to public health. I know something that's a big topic right now for public health and information specialists is communication, risk communications and use of social media, especially during disasters. And we have two really great topic collections on that, which are particularly useful for public health practitioners. It's a risk communications topic collection and then a social media topic collection, and both provide a lot of amazing resources. And something we added this year when we updated those topic collections was a section on mis and disinformation, since that's becoming such a problem that is affecting public health. So I'd highly recommend checking out those two resources, which we can throw in the chat. And then I'm going to open up to the rest of the ASPR TRACIE team. Any other kind of resources you guys would call out?
One thing that I would mention is that we don't do this all of the time, but there are some resources that we have that they might be targeted at multiple populations. So there might be a section in there, and I'll put some examples in the chat because they're slipping my mind as I'm speaking here. But once you see them, it'll be a little bit clearer. But they are showing some examples from different perspectives of things that they might want to think about to work together with partners from different areas. So, it might be a section for healthcare providers versus a section for public health versus, other different types of partners that would be involved in emergency preparedness and response. But I'll put a couple of links in.
Yeah, thank you, Jennifer. Yeah, we are adding some resources to the chat for folks as we mentioned them. And then I think I saw a question in the chat about our new LGBTQI+ topic collection. So that was a topic collection that we developed with the HHS's Office of the Assistant Secretary of Health, which is the Assistant Secretary of Health is Admiral Rachel Levine. And this topic collection kind of started after the Club Q shooting, because Admiral Rachel Levine had been talking to the survivors of that shooting in the community, and they said there was a need for more resources for the LGBTQI community. And they said ASPR TRACIE would be a great place to develop this resource. So we are closely with stakeholders from the field as well as our OSH colleagues to develop a topic collection, which is both for the LGBTQI+ community. It features resources for them, but it also features resources for your emergency responders and healthcare providers about how they can provide better care to LGBTQI+ communities. And it's full of trainings, best practices, behavioral health resources, and a wide variety of resources. And we will throw a link to that in the chat as well. And Karina played a big role in the development of that. So anything additional to add, Karina?
Oh, thank you. I think just to say that we also included, remember I mentioned the lessons learned categories from our other topic collections. And here we've got quite a variety of them on natural disasters, COVID-19, mass violence, and monkeypox. So as Rachel said, we do also provide resources for planners, and a good chunk of those are centered on shelter operations, because we learned that that was a big challenge for our community here. Yep, and Rachel just added that to the chat. Thanks.
Well, thank you, Karina. And I'm scrolling through the chat. I don't think I saw any additional questions this time. Also, please let me know if we missed any.
Yeah, Rachel, there's a question about resources for older Americans.
Yeah, so we do have, we can throw again some in the chat. This was something actually one of our subject matter expert stakeholders flagged for us recently, because it is a population that needs resources. So we have access and functional needs topic collection, which has an older adults category in it. And it is focused on kind of providing treatment to older adults in emergencies. And then we also have several, it's location-specific topic collections, such as long-term care. So even though it is more about the facility management, it does directly impact older adults. And then I'll open up to the TRACIE team again. Anything additional to add? Okay, and I know we are also, again, we had this conversation with our one of our subject matter experts, this is an area we're actually looking to do more work in. So I'd say stay tuned and keep an eye on our resources because you might see something for older adults in the near future.
And Rachel, there was also an addition, in addition to older adults, of folks who have disabilities.
Yes, so in the same topic collection that Karina shared in the chat, access and functional needs topic collection, you can find resources for people with disabilities in there as well. And we actually have a wide variety of resources throughout the website, kind of related to just populations who have access and functional needs, whether it's they are on oxygen during disasters. So we have a lot of resources on there, which largely can be found in the access and functional needs topic collection, but I think there's a couple more we can share in the chat. Karina or Audrey, is there any additional ones for individuals with disabilities to flag?
Yes, I was just about to add the durable medical equipment in disasters and the oxygen tip sheet to the chat. But Audrey, if there are others you can think of.
Nope, that's exactly what I was going to mention as well. Thanks.
Man, thank you guys for keeping up with the many links we were sharing.
And if folks here aren't familiar with the ASPR Empower program, EMPOWER program, definitely check that out on ASPR's site. It's a fantastic program and really widely used by communities during disasters as well to help identify folks on durable medical equipment.
There's a question about do we have a training on how to search the sites? Audrey, I'm going to toss that one to you. I believe there was a training back in the day, but I don't know how updated it is.
It is not particularly updated, but it's still useful. It is, I believe it's available on our ASPR TRACIE developed resources page, and then on that page there is a section just on kind of ASPR TRACIE general info that has like our fact sheet and a couple of the tutorials for very quick tutorials, just 2-3 minutes on how to search the site, how to get into the information exchange, how to navigate the information exchange as well.
And our kind of one of our unofficial policies is if it's taking you more than 5 clicks or a couple minutes to find a resource on the ASPR TRACIE website, please use the Assistance Center. We are extremely responsive and we will track down that information for you and send it right away. So I'd say if you're ever having trouble with the website, do not hesitate to reach out to the Assistance Center. No, and thank you, Karen. I love to hear that the site is easy to use. That always makes us happy.
So we do have another comment in the chat. It says, I'm scrolling and I'm not sure I'm seeing it. I have a friend with dwarfism, and people with that disability are frequently overlooked in disability information lists. It might be there. I'm just not seeing much as I'm scrolling through the populations and access and functional needs page.
Yeah, you are not wrong, Jennifer. There are no resources specific to people with dwarfism, but if you have any, we would love, and this goes to everybody, we would love it if people sent us resources to consider including in our topic collections, because that's really a good chunk of how we receive things to add is from subject matter experts in the field like you. So please do send us things to review and we will consider them too.
Yes, and thank you for that flag, Jennifer. Yeah, as Karina said, this is how we improve our resources. We hear directly from the folks in the field, so thank you. Thank you so much, Barbara. We appreciate the kind comments. And Cecilia. And again, if you ever see any knowledge gaps in general with the healthcare and public health field, please reach out to us. Our job is to fill knowledge gaps and to develop resources for those in the field. So please never hesitate to reach out. Thank you, Claire.
Okay, good. Getting a lot of, oh, do you have in your resources anything about how disability is defined in your resources?
I'm going to turn that to you, Karina. You also came off mute, so perfect. Karina.
Yes, we do specify it in the introduction of the populations with access and functional needs topic collection. So I think it's the fourth or so paragraph down. And we say we respectfully use the term access and functional needs. However, we acknowledge that there are many other terms that are frequently used, and we go into list a few of those. And we acknowledge the changing dynamics, but again, if there are terms here that you would like us to consider removing, please let us know. I know that our contact information is up here on the last slide, so please do not hesitate to send ASPR TRACIE an email with any suggested corrections, and we will look into it.
Thank you for that question.
Yes, and we know, I think a lot of the foundational research that was done and articles that came out early on do not use the most sensitive language, but we do include some of them because they are considered foundational and sort of classics, but we do nod to that. Thank you.
And just a flag on behalf of, I'd say, ASPR at large, not specifically ASPR TRACIE, is there is a National Advisory Committee for individuals with disabilities during disasters. And I know they have a public meeting coming up on the 19th. If I have enough time, I'll try to track that down and put that link in the chat. So ASPR as a whole is doing more work in this area as well.
Well, sounds great. And you know, Rachel, you can, if you get that link, I can add it. I'm going to take all of the links that you all have put in here and put them into a document to send out to everyone. So thank you very much.
Thank you, April. And yep, I'll try to put it in there. If not, I will send it to you directly to include.
Sounds good. Sounds good. Okay, do we have any other questions? Any last minute questions? Okay, I'll do the closing then. Right. Here on my screen. All right, well, thank you so much to our wonderful presenters. This has been a fabulous webinar. And you all have gotten a lot of love in the chat, so that's good. But this has been so useful. So thank you so much for presenting for us today. And to our participants, the link for the class evaluation is on the slide, and it's going to be put into the chat. And we found that, you know, if you copy and paste it into the browser rather than clicking on the link, it works better. And you will receive an email from us in about a week with a link for the recording. And we encourage you to check out the newly updated NNLM Emergency and Disaster Resources Guide, which serves as an online collection of resources and tools relevant to disaster and emergency management. And Erica should be putting that link in the guide as well. And finally, our next event will be tomorrow at 2 p.m., Creating a One-Page Disaster Plan with Dan Wilson. Thank you all so much again. I will stop sharing. Enjoy the rest of your afternoon, and thank you so much to the ASPR TRACIE team for presenting. This has been just a wonderful, just a fabulous presentation. Thank you so much.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.